people get more used to in terms of, I just wanted to make sure like everyone can hear me and see me.
Yes, I can hear you and see you.
Yeah, I can give the confirmation from you, so that's very good, but I want to hear from other people too.
Yes, can hear you. I can
Yeah.
hear
Is this Helen?
Yeah, this
Jesse?
is Helen.
Helen.
This is Helen.
Okay, so
Helen.
I can hear from Helen. I can hear from Varka, and Manohar is still not hearing from you. Jesse is still not hearing from you. Okay, what I do, there's a lot of information over here. So I start, and as I mentioned, keep ready your questions so I can answer the later part. So how we are going to do this? First of all, welcome to this Zoom session. We are doing this particular kind of, we call it public awareness program since 11th of January 2020. So it's a very early stage, and we have over more than 2,000 volunteer we have prepared. The idea here is, my name is Dr. Sanjay Nagarkar, and I am a microbiologist graduated from the University of Hong Kong. So whatever we are going to share today on this particular platform, this is completely based on scientific research. There's no speculations, there's no opinions. It's a pure scientific data. And then I'm going to help you to understand how to review the scientific data, what kind of information you should process or hear or follow, and what you should discard. This is very, very important, because right now information overloaded everywhere, right? So are you agree with me on this? There's an information overloaded, and there's too much information. And as per my scientific review, 70 to 80% information is a kind of like speculations and hypotheses, the theories, ideas, and that's making people very confused. Okay, so we have to avoid all those kind of things. So we will sort this problem out today during this particular seminar. All right, so we start with what is this COVID-19, right? So in order to understand COVID-19, by now, many people, all of you, I believe, have a basic understanding what is COVID-19. And this is a kind of a disease caused by a certain kind of virus, a SARS virus, which caused SARS-CoV-2. So the name of the virus is SARS-CoV-2, which caused the disease called COVID-19.
Can't hear you.
Can't hear you.
Me? Okay.
Okay.
Can you hear me?
Yes, now it's fine.
Yeah.
And now, but you went silent. Okay.
Okay, can you hear me? All right. I think like Veena should not do something. Don't do, it's interfering here. Yeah. So
Veena.
anyone can hear? Yeah.
Yes.
Okay. All right. So the concept people have to understand. I just give a very good example from the past. People heard about HIV virus, right? So it's a virus, but the disease caused called AIDS, right? So same here, the name of the virus is SARS-CoV-2, which is causing the disease called COVID-19. A very simple fundamental fact. Now, there are a lot of history behind it. right now we are talking, this is a coronavirus. So like in the common terms, people are talking, okay, coronavirus. Coronavirus is a kind of virus, a type of a virus, but there are so many strains or species of this virus. So whenever you are hearing a lot of information that coronavirus is already known for so many years, they have a vaccination, they have a treatment, they have so many things, that's actually wrong, because which coronavirus? Okay, so right now we are talking coronavirus SARS-CoV-2. So the purpose of this particular seminar is to talk about coronavirus SARS-CoV-2. So that's how we have to make sure. In 2002, we experienced the outbreak of SARS, right? Do you remember how many people actually infected during SARS in 2002?
Oh, it was under 800 people, I think.
No, how many infected?
8,000 something.
Oh,
Okay, right? So that's what we have to understand, because like if we have to understand this properly, we have to understand a little bit history behind. So let's see, like in SARS, around 8,000 people infected worldwide, okay? Worldwide, only 8,000. And of which around 800 died.
Died, yeah.
Right? So
Right.
that's why we say like the fatality or mortality rate is around 10%. But what you have to notice here is only 8,000 cases worldwide. So this is the first thing. Then there is a second, it's called MERS. Yeah, the second virus, which is 10 years later, called MERS, MERS, Middle Eastern Respiratory Syndrome.
Yes.
How many of them infected? Any idea? Any idea how many infected in MERS? Not many people get infected, okay? So only 2,000 people get infected around the world. And then 850 people died. Okay, so the rate of fatality is much higher here. But then you see a little bit a scientific catch into it. The numbers you have to see 800, 8,000 and 200, 5,000. It's such a low number of infection as compared to COVID-19 right now. Agreed?
Correct.
Yes. This is the most important thing people have to understand. We have a SARS, we have a coronavirus epidemic before, but the total global infection rate was only 8,000 in SARS, and in MERS, it was only 2,500. We are not talking how many died, okay? We just say how many got infected. So if we put these two together and see the current situation of coronavirus, now it's more than 800,000 worldwide. So straightforward, you can understand there's no comparison in between SARS and MERS. This is the most dangerous ever seen kind of infectious virus in the history of mankind, or you can say the first virus in the time of social media, spreading so fast, right? So what we have to focus over here, we have to learn how this virus is spreading so fast, right? This is the key issue, that why this virus is spreading so fast as compared to the SARS or MERS. You should ask this question to yourself. So many people, those who are a little bit like careless and think like this cannot happen to them, and so many people die of flu, this, that, so many kind of things. Please keep all that opinion aside and try to understand that we have a true history in past 20 years, MERS and SARS, and then the total infection was 8,000 and 2,500 as compared to what we have over 800,000. Okay, in few days, definitely is going to cross 1 million. So no comparison, first of all. Now, the nature of all the three viruses, somewhere same. So SARS believed to be coming from bat, and then intermediate transmit mutated in the civet, is a kind of another animal, and from civet it mutated and came to the human. And then it's mutated and started transmitting human to human. That's how it is. Okay, so that's the pathway. Like it's a mutation, it's a bat virus, believed to be like that. It's very difficult in science to track down a perfect origin of the virus, but largely it believed in that way. The Middle East virus also originated from the bat, but it intermediate transmitted, mutated in camel, and from camel to the human, but it was restricted to Middle Eastern region. Now the coronavirus, it's also from the bat, but the intermediate one in pangolin. Do you know what is pangolin? You know about the,
Yes.
yeah, pangolin, right? So that is
Yes.
believed to be. So right now, the original virus is from bat, which is mutated in pangolin and then further mutated into human and now transferring from human to human, right? So there's a few mutation took place, and now within the human, it's taking further mutation like that. Now, the question here is why this virus spread so fast as compared to SARS or MERS. In order to understand that, today I'm going to share something basic science, very basic science. It's like you can say like a household science or community science in a very layman language. What you have to understand, it's called R naught. There's a word called R naught. It means a reproductive ratio of the virus. Or in other word, the what we can say is a degree of spreadability. Okay, so there is a kind of measurement for every virus. We call it degree of spreadability, means how fast it can spread. So just for example, the previous viruses, or say take in common word, influenza. You all have heard about influenza. So the influenza spreadability R naught ratio is 1 to 1. It means like if one person get infected, it will infect the another one person, and that infected one person will infect another one person. This is very important to understand. In this way, what happen usually with all the viral diseases, the curve is always a flat. It never go exponential like this, because one person is infected, the another one is another one, like that, so forth, so on, like it's going in a chain and the flat chain. But now with the COVID or coronavirus, the present case, the R naught factor is 3. It means the one person can infect 2 to 3% at any given time period. So imagine a scenario that one person infecting 3, that 3 are infecting 9, 9 to 27, like that is an exponential growth. So this is the only difference. All the virus in the previous time, they have R naught factor or a spread factor 1. So they were spreading 1 to 1. They were not spreading more than 1 people. So the number was always very low. Here, the spreadability factor is 1 to 3. So the time they can grow exponentially. That's why it's spreading so fast. So once you understand this, now, the only way to stop the spread is when we make R naught or spreadability factor less than 1. Right now is 3. So unless it is 3, the cases are keep going up. If the 2, the still cases are going up. If it is 1, then you can say we flat the curve. okay, then still people are infecting 1 to 1 to 1. But in order to reduce the curve and control the disease, it has to be less than 1, right? It means like many of them are not infecting anymore. This is the key point to understand. Now, with this, there's another factor which you have to remember. It's called SI factor. SI factor is called series interval. Okay, so one is the R naught, which is the reproductive ratio, means how fast it can spread. The second is RI, SI, sorry, SI. SI is series interval. Series interval means, suppose patient 1, he get a symptom from day 0, and then it run all the way 14 days. Now it infect the person 2. The person 2 get a symptom on day 4, and then it spread for 14 days. The person 3 get symptom at the day of 10, and it go further. So like that, the gap here in this virus is pretty big. It's an average 7.5 days. So we have a high reproductive rate or spreadability factor, and we have a big gap. This is the only good sign that coronavirus is still spreading in an exponential way, but it's taking a little bit longer time to spread like that. This is by chance is a good luck or good sign. Imagine that like an influenza virus. In influenza virus, the series interval SI is 1 to 2 days. It means today someone is infected, they infect the other person, within 2 days, the other person get the symptom. Imagine that if that would happen here, the case scenario with the coronavirus, right now, maybe 20-30 million people already been infected around the world. So this is the like a good or bad sign over here, that fortunately the SI factor is 7.5 days right now, as per the scientific research. So it's growing exponentially, but it's growing like a little bit, taking a little bit longer time. And as you see, that's what happened everywhere in the world, that they are going initially flat and then they are started going up because of that SI factor is slightly longer. And that's why we have to worry. Why we have to worry? Because the symptom is not appearing very fast. Symptom is, we call it delayed symptom. It's taking some time. This much is clear? Yeah? Hello?
Yeah, that's clear.
Yeah, that's clear. Great. So that's what is saying, like why other viruses do not spread so fast, and why this particular virus are spreading like crazy, because of its spreadability, like reproductive ratio is very high, right? Now, what we need to understand here, how it is spreading. Initially, there's a lot of things we are talking in terms of how this virus is spreading to the people. The first point, sneeze. People say sneeze, coughing. These are the 2 points people are saying, sneezing and coughing. So the person who is infected sneeze and cough. So the virus particle go and infect the other person. It's very simple, everyone can understand. But then we have to understand also, we have to ask a question, is so many people who get infected are really encounter people around them, those who are sneezing or coughing? Because today, if you believe, all of us, we are keeping ourselves very far from the people who are sneezing and coughing. So the question comes in mind, then if we are not coming in contact with the people, those who are sneezing or coughing, then how come this virus is spreading? So that's where a few points we have to understand. It's all based on the scientific data. In US, India, many countries I have seen health officials and the agencies said no need to wear the mask. But like last 2 days, everyone is changing their statements. It's very important to understand this particular point. What is happening that previously it was believed like if someone is sneeze or cough, it can go up to 6 feet, 2 meters like that. But that's not true. There's a lot of research in the fluid dynamics that when we sneeze, there's a jet stream, take the viral particle or the aerosol particle, at least 6 meters is 18 feet, okay? So the virus is going up to 18 feet. The bigger particles can drop and settle faster. The smaller particle can stay in the air. So what is the difference between the big particle and the small particle? Big particles are larger in size. It is not in a micrometer. Okay, it's usually like a millimeter kind of thing. The micrometer is the particle size from 1 micron to 10 micron. So less the size, lighter they are. So what is happening? Most of the microparticles, they are floating in the air. So if the air, you are like in a room or you are in the place, there's no proper ventilation, this air particle are staying there for up to 27 hours, 36 hours. Not enough research out there. A lot of people are saying different things, but like let's say the latest research up to 27 hours. It's keep floating. But if you keep the ventilation on, this all small particles move from that place immediately, right? So ventilation is important. And that is why you see like many people are getting infected, where a lot of people are gathering. There's no particular ventilation. And if we talk about the Hong Kong scenario right now, the karaoke bar, the other bar, the religious centers, a lot of people gathered there. So there's a suffocation, there's no proper ventilation. So this is one of the things, sneeze and coughing. But then there's another part. Even when you are talking or taking a heavy breathing, the virus is still coming into the air and then surviving in the microparticle, at least for 24 hours. Some people say 3 hours. So different kind of thing. So whatever the maximum result comes, like say 24 hours is there. This is the second part. So talking, breathing can also, not necessarily sneezing, can remove, like can bring the infected virus particle into air with a micro particles. Okay. People are giving different scientific names, aerosols, etc., like other kind of names, but like I use for the simple understanding is a small particles in the air which can float. Now the third thing is, imagine that this infected person is going and not telling other people where to go. And he is talking, he is breathing, he is touching. Suppose he went to the grocery shop, right? There's a lot of groceries are packed, and there are a lot of stuff, especially the fruits and vegetables, are not packed. It's open, and there's a tendency of the people, they go and look for the fruit, whether it's nice, and then put it back, and then they pick up another one. So they are touching a lot of fruits and vegetables and put it back. These are lying over there. Then they are touching many surfaces. Okay, they're touching like a lot of like wherever they sit. Like suppose they're dining, they touch the surface. They're touching a lot of metals every day. They are touching a lot of plastic every day. They are touching a lot of glasses every day, right? One of the things like spread the word, like viruses are spreading more from bars. It's not through the alcohol or gathering. Maybe that is one of the idea, but the other idea is there's a new research that virus can stay longer on surfaces like glass, plastic, metal, cardboard, many surfaces up to 9 days. So 4 days to the 9 days. So imagine that someone visited some bar today, have a drink, uh, the glass was not washed properly by the company, and then they serve the alcohol to the next person in the same glass, so the virus is staying there. What I mean to say that it is not necessary that you come directly in contact with the infected person. This infected person, wherever they are going, they're infecting the surface, they are infecting the air, and they are infecting like all the things around them. If you pass from there without knowing, because these are invisible stuff, how do you come to know? Like suppose you take a ferry, you take a elevator, or you go into the grocery shop, we just don't know who are the person came before us was infected. So these are a high risk things. That is why now the word coming social distancing, right? So social distancing is one of the topmost measurement people are going to take right now, because that is a one of the thing we can avoid, the air particle. But that's not enough. If you listen over here, the virus particles, the air particles can go up to 6 meters, right? The surface can contaminate for a few days. So the idea is, we, besides social distancing, we don't have to touch. We don't have to touch various surfaces. Touching the surfaces, traveling into the public transportation is all high risk at this moment. If you see the Hong Kong scenario right now, the last 1 week, average cases are 40 to 50 per day, right? So it's still like going something like that. But then we don't know how many people are already got infected. The symptom will appear in coming days, kind of thing. So there's no direct projection, because we are dealing with something unknown, we can't see. So self precaution is very, very important. Okay, this is the part. Now what we have to understand here, the lot of people, what we are hearing the data, those who are confirmed with COVID-19. But we don't know about the people who are carrying the virus and still didn't develop any symptoms, and they are among us. It can be millions, because there are, now we know there are symptomatic cases and there are asymptomatic cases. So there are symptomatic cases where people have a clear infection and they are hospitalized or waiting to hospitalize, and the proper precaution is taken care of. So once we know, like, oh, this person is infected, that's where our brain is working. Okay, take care or be far from that person. That's how our logic works. But what our logic is not working, that we are not taking precaution what we can't see. So we are going to grocery store, we are taking ferries, we are taking MTRs, we are taking public transportation, we are taking lift, we are pressing the lift buttons, and we are touching the railings of escalators. It's a human habit. So right now, it's a very high degree of discipline is required, because you see in Hong Kong, like Hong Kong, though 40, 50 cases, is so many people out there. I see every day so many people not wearing masks, so many people touching the surfaces. So these are the things. This is like somehow their mind may be working, oh, today we have only 700 cases or 800 cases. I'm not in contact with them. I'm far from them. But right now we have to ask ourselves a question. In Hong Kong, there's no wide scale testing. Okay. So now I move to some example, what happened in Korea. We should take an example from Korea. We take an example, Singapore. So I will not go into detail here, but I would request you to read how the Korean authority has combated this situation, how the Singapore authority has combated this situation, and at the same time, why Italy is shooting up so much, Spain is shooting up so much, Germany is shooting up so much, and US is absolutely going crazy. The reason is very simple. When at the initial stage, when the health warning was going on, people took it very lightly. Okay. So they were going out without the mask, they were touching the surfaces because in their mind, they couldn't see infected person around them. That's the logic. Can you get this logic? This is like a psychological, it's a science, but it's a psychological factor that if we don't see a patient around us or infected patient around us, we think like, okay, we are safe. We are not in touch with them. Am I correct? Yeah, I'm asking like, am I correct? Can someone mute the video and say me? Hello?
Hello. Hi.
Yeah, hi. Can you hear me?
Yes.
Yeah. And did you understand the logic which I mentioned? Like means if this is a psychological factor, if we know that we are not in touch with any infected person, we are safe.
No, we are
Yeah,
not safe.
definitely.
Yeah,
That's a psychological factor, but it's probably
exactly.
not really, it's not true. We can
Yeah,
think we are,
exactly.
we're
Yeah.
not.
So the main point here is what we are trying to make. We don't know that we are surrounded with this virus. Now, what latest research is saying, the
Go out.
symptomatic persons are only 20%.
Mm,
80% people are asymptomatic.
with this.
Okay. So this virus is infecting millions of people, but many of them are even recovered without having any symptoms, and even they have no idea they had this COVID like coronavirus. But imagine that these are the carriers. Nothing happened to them, maybe because of their immunity or other perfect health condition, but they were the carrier. Wherever they went, they may have infected the place, and then the people with the low immunity, other health condition may have got like received this virus so easily. So that's the one of unforced situation going on, and that's the risk going on. So we are not talking something rocket science, we are talking something very simple. That what we need to understand right now, I have seen many people, they say, oh, don't shake hand. So instead of shaking hand, they're like putting their elbows, touching each other. Like this is the time to correct our behavior. There is a state rule of social distancing. We should not touch people. We should keep far from the people. Okay. So that's the thing, because this virus, where it is, we don't know. Because we are dealing with invisible, right? We are dealing with invisible. People not staying at home. People are going out. The only way to deal with this is to stay at home right now. Okay. Why? Because these are the reasons. Like so many places may be contaminated. They're infected. and we don't know which places are infected. People say, okay, this elevator is disinfected every 1 hour. Can we believe them? Is it true? How many people sincerely following the rule? And in Hong Kong kind of situation, we have to go so many places where we have to use the elevator, almost every places. And then we have to press the button. But we don't know how many people press that button before us, or whether it is sanitized or not sanitized properly. So the implementation of the rule, the hygiene rule, whether people are following or not. So this is the key factor I'm trying to explain over here. Now, we already discussed why this virus is spreading so fast. Many reasons beside the virus is also there's so many like unknown factor. Contamination. Usually virus is a very host specific. So giving the example, we all heard about hepatitis. So the hepatitis virus will affect the liver. So the virus can affect respiratory virus will affect the respiratory system. So if the liver virus, hepatitis virus cannot infect the respiratory system and vice versa. So virus is very host specific. And that is the reason we have a defense mechanism that because of that, not millions of people are infected right now. Because virus need to get a respiratory related tissue where they can bind with. So infected person right now going out, sneeze, touch the contaminated, touch the surface, make it contaminated. But now imagine that you and I, if we want to go out, people saying wash the hand is good, but we want to go one step further. We have never seen people wearing the gloves in Hong Kong in such a serious situation. Because when we wear the gloves, we completely 100% avoid the situation of touching any contaminated surface and contaminate our hand or skin, right? So people are people only stuck with the mask. Many people are not wearing the mask. So how can we talk about wearing the gloves? I'm talking about the absolute hygiene over here. People need to understand about absolute hygiene. So wearing the gloves will allow you to protect yourself from all the contaminated surface. You come home, you throw the gloves, straightforward. Okay, 30-day quarantine, you are using 30 gloves, but it will save the life. It will save the infection. Second, mask. Many people not wearing it. People say, oh, it doesn't work in that way. A lot of different kind of information out there, but that's not true. What we have to understand is a social responsibility. We have to wear the mask. Now there are different kind of masks. Yes, we do agree that surgical mask, cotton mask. Cotton mask is not useful in the virus kind of situation. Surgical mask up to certain extent, N95 is in the better extent. So I would say the people, those who are sincere, really try to have more and more N95 masks, because we cannot take a chance. So if we want to take a chance, then okay, like normal mask is okay or cotton mask is okay. But suppose we don't want to take a chance, then you have to be absolute precautionary measure. You have to take absolutely precautionary measures. So N95 mask, when you go, gloves you go, or good surgical mask, these are the things. If you are outside coming home, the first thing is to wash your hand. And at least like right now, it's to generate a new habit to wash 10 to 20 times your hand every day is a time to generate a new habit. Okay, we have a lot of questions. We have a lot of hesitation based on our past lifestyle. I would say we're born again. We have to cultivate a new hygiene habit. We have to forget everything about past. The whole world is changing, right? So this is the thing. Someone say, oh, how I can wash 20 times a hand? It's not possible. You have to make it possible. It is important. Because if we are not wearing the gloves, you're touching a lot of surfaces. And if you're touching a lot of surfaces, there's a high chance of getting contamination. Now this contamination is the virus through the contamination is not going to like the person transferring the person, but when the person is going home, okay, we are saying stay home. Now some member of the home is going out and not following all these hygiene precautions. So even the 5 family members, those who are staying home, or 10 members or 3 members or 2 members, is not helping them, because this one person has already brought that contamination inside the home. Now this is on your kitchen platform, it will be in the air, it will be in your washroom, all over the places. There's a lot of kids at the home, kids is running around, touching the things. So inside a home, we are behaving like a normal people. And I think like that's where the mistake is, because none of the home can say complete lockdown. Someone is going to buy the grocery. Someone in the home going outside, you know. So we have to understand that traceability. As soon as you enter at the home, the first thing is like if you're touching to like remove your shoes or any other things, the first thing to wash the cloth and the hand. Okay, so like cloth is like you keep changing your clothes all the time, because 9 days, remember, as per the research, 4 to 9 days, virus can survive out of the body. This is the key part, right? So now what is happening? Someone, for example, infected somewhere else, have nothing to do with us at all. But the contamination through the surface, through the people, through the grocery shop, through the lift, it reached to your home. And then we say we have a home quarantine. Is home quarantine will work in this manner? Will not work in that way. That's what we need to understand. So this point is clear?
Yeah, that's clear.
Yeah, all right. So staying home is not enough. We have to maintain the full precaution inside the home. We have to ask all of our family member if they are going out, where they are going out. It's like a little bit of lengthy homework for every person. When you meet your family member at home in the evening, if someone is going out, you have to ask that person like, hey, where you went, how many people you met, whether you went to the grocery, you touched the product over there, like vegetable, fruits, you went to like a wet market to buy the meat, other stuff. Have you like use the public toilets? These are the questions should come on a daily basis for every household. We never ask if our kid went out and coming back home, we don't ask them like, hey, where you been, right? In that case, our home quarantine will not work. So the idea is, if home quarantine people are doing, staying at home, 2 very important things: full range of hygiene precautions, washing hand, sanitizing, whatever we can do. But the most important is ask every person who is going out, maintain the record where you've been out. The traceability, you have to do the traceability and make sure, like, doesn't matter. I have seen so many people, they're taking it lightly because they cannot see this virus. Okay, so the thing is like, need to get serious. You will not see this. This will happen. Okay, so traceability. So adding one more point over here in home quarantine, beside the whole precaution, traceability of the people who are stepping out of the home. And even if you are traveling somewhere, you make sure the first thing when you go home, clean yourself. And even you can take shower much better. Okay, so that's about the home quarantine. Few things about the home. If people are staying in a home, what are the things we touch most? We touch the doorknobs, we touch the switchboards. There are many places we touch a lot. And these are the places need to sanitize every hour. So the good sanitation practice, hygiene practice for every family member now is a responsibility. Okay. Staying home and just enjoying the life and like laughing, sneezing, hugging, it's not going to work right now. Social distancing means even at home, you have to have a social distancing. Even for the people, those who have the bigger house, don't sleep the partner on the same bed. Try to sleep in a different rooms. This is serious. You have to understand, like we are talking about the absolute measure. So we are going a little bit into deeper, and that's the issue. Like people saying like, hey, like, is it like so bad? Why should we do all those kind of things? But what we are saying, like, if we do it, we are not doing it for the whole life. We are doing for some time. And if we do it, we are a happy people at the end of the day. The hard work will pay off. Okay. So you will be a kind of a responsible citizen, good citizen, who are not only taking care of your hygiene outside of your body or home, but also you are taking care of inside your home. So the point here, inside, right? So now you have to relate these 2 points together. The virus is spread through the cough, sneeze, surface, talking, touching like surfaces, coughing, sneezing, and talking, right? So there's a lot of different kind of like a way the virus is spreading. Now this virus, many people are asymptomatic, means they don't have a symptom. So psychological thing is coming, I'm not contact with the person who is infected. Wrong. There may be a person infected, we are very close contact with them, and now we are coming home. And if we don't maintain hygiene practice at home, we are infecting the people at home. And then the infection, the symptom may appear, may not appear. If may appear, if the delay appearance, it will take 7 to 8 days, 2 to 5 days, 7 days. And if it is more delayed, then by the time you infect more people around you. And this kind of things like called the cluster infection, right? So we have found like certain bars, certain karaoke places, certain religious places, which is the hybrid ground for this cluster infection. So these are the very simple thing. I'm not talking something like very difficult. I'm talking something very simple right now, which people are missing. We are dealing with invisible. It's a microbiology. What is happening, the another point is, most of the statements coming from the doctors. Now you have to understand, in doctors, there's a classification. There's a cardiologist, there's a neurosurgeon, a neurologist, nephrologist, gynecologist. They are specialized in their field. So therefore, right now, the respiratory doctors, those who are the lung expert, they are expert on clinical cases, right? So if someone get infected, they admitted to the hospital, doctors, they know best how to treat them. They're treating them, the infected person, on the front line. But what you have to understand, those who have no symptom and not infected and have the possibility of infection, the doctors cannot say much about them, because this is the area of the research, like how the virus spreading in from one person to the another person, or in other words, viral ecology, that how the virus survive outside of the body, right? So far we know a lot about virus surviving inside the body, fine. Okay, doctors are there, healthcare workers are there, they are taking good precautions, they are doing good service, everything is very good. But now we are talking about when the virus is not inside our body. And this is the another virus which is surviving longer time period out of the body. So the catching the infection. So that's where the microbiologist or the microbiology comes in. The microbiologists are expert to tell you how the whole pattern, the behavior of the virus. So there's a lot of research lab right now, those who are not on the front line, a lot of research lab working on the behavior of this virus to find out how they are spreading, how long they can survive, mode of infection, etc., etc. This is the one part. The other part is working, which medicine is working, which vaccine can work, all kind of things, a treatment side, right? Now we move to the treatment. So this much is clear? Yep. So we move to the treatment side. In the treatment side, people are using combination of drugs, and the ultimate treatment is vaccine production. So what we have to understand, there's a lot of news coming like, okay, there's a found like good solution and the drugs is coming out very soon, the vaccine will be out very soon. Nothing is going to happen like that. What we need to understand, there's an average procedure of 12 to 18 months when the vaccine, even if developed so fast, will come in enough number in the market. Okay, so it's a long-term battle. It's not something very quick we can do that. Any drugs so far all around the world, the same drug combination is not working with every patient. So this is also important to understand. It's not working with every patient, right? So we are far away from that. So it's someone is working with certain drugs are working well on some people, and other drug is working on some other people like that. So there's no similarity kind of thing. So a lot of variation out there. This is the realistic scenario. Why we are not able to manage this so well? If you see a lot of news coming from America, a lot of news coming from Italy, that the healthcare worker and the healthcare system is overwhelmed. The common thing is like not enough ventilator, not enough facility, and all those kind of things. So that's what we need to think about. Now, many people say like, oh, people cannot die, or like it's like more people die from flu. This is not so serious, and all those kind of things. Use a logic. Use a logic. If hundreds and thousands of people are sick at the same time, then definitely the healthcare system will collapse. They will not have enough manpower and the facility to provide the healthcare solution to everyone. And that's what the adding cost to the death. So it's not like I get corona and I will recover, or I get corona, I will die. What we have to understand, it is our combined responsibility that numbers should remain low so the healthcare facility can combat with the crisis. If the healthcare facility get overwhelmed, then the pay attention to deal with so many sick people delayed. Okay, and delay is one of the reason the complications start, the symptoms start, and that's why they are also dying. So this is a very common sense, and the logic is not that people is dying because of the disease only. Maybe this disease are creating the secondary symptoms. Like there's a lot of people, those who died have other health condition, right? So these other health conditions getting worse during this particular time period, and people are dying from other health conditions. Let's say, for example, there are so many cases coming of the cardiac arrest, right? During this time, the heart rate go very high, and if the heart rate go further high, there's a cardiac arrest. There's a lot of like the kidney complication, there's a liver complication. There's a lot of people have a kidney transplant. There's so many people out there with the kidney transplant, they live on the immunosuppressant drug. These people always have a low immunity. So the people which has a low immunity are the high risk people. People with the diabetes, people with like heart disease, they are the high risk people. So what is happening? There's a lot of people with a high risk. And a lot of people are falling sick at the same time. That's what we have to understand. And because a lot of people falling sick at the same time, the medical system is getting overwhelmed. And because medical system getting overwhelmed, it's very difficult. Technically, it's absolutely difficult to take care of so many people. You are hearing the news, like, do we have enough ventilator? Okay, do we have enough medicine? Do we have enough manpower? Do we have enough protective gear? So there's a lot of things you should watch, how the healthcare workers are facing the challenges. It's like very, very emotional stories coming from all over the world. So that's where our responsibility is coming in, that we have to make sure that we keep the number low. If it is outbreak, then it's not only a disease, it's a burden on the healthcare system, and we don't want healthcare system to collapse. So if the healthcare system collapse, it means there's a delay of the treatment. If the delay of the treatment, who are the people getting first line of high risk? The people with diabetes, heart disease, other health condition, and low immunity. So that's where we enter in the point of the immunity. So I think like one of the most important part is your immunity. Right now, people are thinking, because there are more than 4,000 research papers, but it's too early to say anything. So right now, nothing can be said in an accurate format. So right now, the research is going on. We need to know a lot, and time, it will take some time. What we are trying to do over here, many people, those who are sick and recovered, they're sharing their stories. Doctors are sharing their stories, okay? But what we don't know is a large number of asymptomatic cases, or you can say non-clinical cases. So these people are all around us carrying this virus, and we don't know how many more people will be infected in the future. So we have to cut the exponential growth. So at the beginning of my talk, I mentioned the reproductive ratio, R0. It is right now around 3. Unless it becomes less than 1, we cannot bring the graph down, right? So all of you, if you follow what I said today, this is the maximum precaution. We keep the virus away from us. It's not getting infected. When the virus is not finding the more host to survive, it will automatically slow down. Look the Korea case, look the China case, okay? It has to go down like that. That's not the situation right now in Europe and America. That's not the situation in Hong Kong right now. Every day, there's a 50 on an average, 40, 50 cases coming in. How many will come? No one knows, right? So the key message today is no one knows. We are dealing with invisible. So when we are dealing with something invisible, no one knows. In that case, we have to be very responsible. We have to deal with all the precautions. And these are the small things we are missing. And in our technical language, we call there are the leakages. It's a leakage. How many of you are going to get the grocery? How many of you have a domestic helper who is going to get a grocery? In the grocery store, how many times with the empty hand you are touching the fruits, vegetables, and then leaving it? Who else is touching there? Are we tracking like who came before you? There's so many questions and very important questions, right? So I think like this is the main part today. I try to explain. Let me see if I have to mention anything else. Yes, there is some research. This research is saying like if we have a 62 to 71% ethanol, it can disinfect, it can kill the bacteria, virus, right? So if you are using any disinfect or sterilizer at home, a sanitizer, you make sure it has alcohol 60 to 71% or 0.1% sodium hypochlorite, which is a kind of a basic household bleach. It has that, so bleach the house kind of things, that's there. Now, the final thing, if we really have to deal with this, I think everyone must support the testing. Right now, the people who travel, government is asking them the quarantine. And if they develop the symptoms, then only they are asking for the testing. But how Korea combat with this? How other parties combat with that? That large number of the population should be tested, whether they have a symptoms, no symptoms. Most of the people with no symptom, with travel history must be tested. And there's a testing called, very popular test going around in the world is called NAAT, N-A-A-T, which is a nucleic acid amplification test and getting very popular around the world. Right now, it takes 3 to 5 days to get the test done. Okay, so in Hong Kong right now, I think like if we do mass scale testing, then we have a higher chance to bring the R0 less than 1, and then we can control the virus. There's one of the rumor that people say if the temperature go high, this virus will disappear. Some of the research is showing that up to 56 degrees Celsius, this virus is still alive and functioning. So I don't think the human blood temperature or something like that, it will be so easy to disappear. This virus is very different in nature, and acting in a different way. So this virus is not spreading so much. We are the people spreading the virus. So I think like that's my information for today. And then I will open up for the question answer session now.
Yes, so everybody can unmute yourselves, and if you have any questions, you can ask him, or you can even type it down in your chat box, and then we can answer that.
Yeah,
so
we are
everybody
asking.
Can hear?
I've put a question. I typed the question in the questions box.
Or you can tell me the question. I can hear you.
I was just because you know, when you talk about the research, like you said, some research is showing that it can survive 56 degrees centigrade. you know, if I tell people that, they're going to say to me, well, where is this research? Where can I read this research? Because a lot of people want the scientific evidence. They don't want to just hear it like a gossip.
Okay, all right. So that's the purpose, like I'm giving this seminar because I myself like a microbiologist and I'm a scientist, and whatever we do, we don't say without having a proper research article.
Oh, I know you don't, but I mean,
yeah.
How can I share that piece of research?
Yeah. So that kind of piece of research.
How can I access it?
Yes, there is like, I will forward you the site. You can see like there are more than 4,000 different kind of research articles is out there. But again, what is happening, some people, they are getting like information overloaded. So the people need to understand how to take the information from the research article, because these are the research paper which is done in a scientific protocol. So the way the scientific research is done,
I know how scientific research is done.
Yeah, so most of the people like should able to interpret the communication properly. So yes, I can send you the link where you can get.
It's just, if you're trying to educate people, you know, some people will say, well, how do you know this? And where's your facts? And where's your evidence coming from? So you want to be able to tell them where to go to read that piece of evidence if they would like to see it is for real.
If Sanjay Nagarkar is speaking here, this is the thing like that, like I have a wrong credibility, credibility on this particular line.
Sanjay, I don't think you're getting my point.
I'm getting your point. What I mean to say.
But I'm not questioning your credibility. I'm saying if I want to educate people, they're going to ask me, where is this piece of evidence I can read that says.
So what you have to do exactly like me, because it is virtually impossible. Like, okay, let's put in this way. When we do PhD, doctorate degree, it takes 3 to 5 years. And in 3 to 5 years, we hardly able to read 200 research paper. We can decode their data and study it. So if people think like they can read a research paper and they can find out, that's where you have to, if you understand science, you have to discourage this to the people, because it's if someone want to read the research paper, it's better to join the PhD and do the PhD on the subject right now, because that's what the PhD is all about. And then you put your own publication, right? So
I don't agree with that.
Yeah, so I'm just trying to give like, you need to interpret something in a very articulate way, and then you should have a link. So right now, I will send you the link where all this research is open source, right? So there is nothing like hidden. Everything is open source, right? People can read it.
Cited.
Yeah.
Exactly. So, that's what I'm meaning though. That
exactly.
Just so that they know I'm not just making it up. Like I can say, this is where it's coming from. Of
course, everything is open source.
But they're probably not going to go and read it, but they want to know that it is there if they did want to read it, even though they're probably not going to read it. Do you know what I'm saying? So that they feel secure that it's real.
Maybe what you can do, the other suggestion is, like usually we quote, right? We quote the,
you do what?
We quote the publication, right? So sometime when you have to say, you can quote the publication.
Yes,
so one of the example I just wanted to give you here. 1 second, I show you something. So there is a published scientific research article confirms survival of SARS-CoV-2 virus up to 9 days on glass, metal, and plastic surface.
Yes.
Okay. And then we quote the Journal of Hospital Infection. 104 is the volume 2020, and page number 246 to 251.
Okay.
Okay. So that's how the people, if they want to know, they can straightforward go to that reference and they can read it. So if you really have someone who want to know detail, that is a procedure. You can give them the quotation, like quote, which journal you have quoted to.
And we're getting the recording of this afterwards, are we?
Pardon?
We will have access to the recording of this Zoom session afterwards. So I've got that reference because I can't write it down right now.
Oh, no, don't worry about it. Like I'm just giving you the example. What I mean to say, all the information right now are open source. So what I will do, I will send you the link so you can go through all this kind of like beautiful collection of all the research. So you will get a lot of information. The idea is like
Yeah,
those
yeah.
who
But some of the
understand
people,
science, yeah, it's for them,
yeah,
but for not the
some of the
normal people.
people that, no, this is people who are science-based people who are asking me, well, can you
Oh,
tell me where
definitely.
this research is? Because I want to read it. Yeah,
Oh,
I want to
definitely.
read
By
it.
all means, yes, can be. It's very exciting. In fact, like there's a lot of information coming out every day. A lot of work.
Yes.
Yeah. We'll do that.
And there's
So,
some,
okay.
and there's
So,
some people that won't read it, but they want to know that it's, they want to know the source, even though they won't read it, because they want to know that you're not just repeating something that you heard
no.
without knowing. I know you're
No.
not. I mean, people
Yeah.
want to know that that's not what I'm doing. Like, I could have just heard it as a piece of gossip rather than heard it from a reliable source, but they want to know what is the source.
I think like
what's-
right now there are certain a way to do it. There are 3-4 important publications, journals,
Yeah.
and most of the research are published there. So maybe
Okay.
to educate your group of the people, you collect like 50 to 20, maybe I can tell you those 50 to 20 important publications. And these
Yes.
publications are covering all the major informations.
Yes.
But now,
That'd be good. Yeah.
yeah, because these publications, the sampling size is very small. That's what we have to understand. These are the all initial
Okay.
level of research, right? So therefore, I'm mentioning this, that this is not a final verdict.
No, of course
In
not.
coming
It's still
days, we are
being
going to learn a
researched.
lot.
Yeah.
This is the preliminary information, okay, at the phase 1 information, you can say.
Yes.
Right? So, okay, so that's how for you, I can do that. Like there's a list of certain links, then you can read, and then you can develop a data for your people. No problem.
Okay. All
Good.
right. That
Thanks.
would be excellent. And I can share with you on Saturday morning after I've been on the functional medicine training. She's doing virus myths and opportunities, and she
Sure.
will have read a lot of research documents to do that talk.
Sure.
Yeah.
That would be nice. Great.
Okay. Great.
Okay. Thanks, Ellen.
Thanks.
Yes. Yeah.
Does anyone else have a question?
No.
Barka, Manohar Chokji, are you there?
Yeah, still there. No questions.
Yeah, no question. Why?
It is a little difficult to do with the home people, when they're going out and then coming back, and we never wash our clothes immediately, like just wash our hands, and that's all we do.
No, like there is a lot of like way to do the disinfection. Usually like imagine that the people, those who are into the hospitals, and the people, those who are into food safety kind of like work, they have to go through a particular kind of procedure. So what I mean to say, you can take a little bit better precautions, at least ask people where they went, and not to mix up the people like they don't know, not to go to the area they don't know, avoid supermarket a lot. These kind of basic things can be done,
How can you avoid supermarkets? Because your helper or somebody is going to be going to the market every day to buy things. So that is unavoidable.
No, see, you have to teach, because what I said, I gave example that SARS was a big issue, but how many people got infected? Only 8,000 people. We have to remember the history. MERS, we talk in such a big way, only 2,500 people. But when we talk about COVID-19, it's, as per today, is over 800,000 people in the world. In next 2 days, definitely over 1 million people.
Right.
So you have to see the speed of infection going so fast. So it's training, is helping people, like either wear the gloves, the plastic gloves, and throw it, like if touching the surfaces like that.
So
Or
my
come
question
home
is,
like
when we are buying all these things and coming home, whether it's fruits or vegetables or even like bottles. How can I mean, is there any particular solution we use to disinfect it? Even the bottles, for example, if you're buying a bottle of oil or a bottle of, uh, bread or something, the
No,
plastic,
that is,
everything.
see, that is going like too much kind of a stuff. Here we are talking about um, the possibility of contamination and reduce the possibility of contamination to your hand. So mostly what happens, there's a human behavior. When people buy a bread, people don't pick up a 10 breads and then take one. Okay, they just pick up the one and go because it's a packed food item. So people actually don't look very much into the packed food item. Where people do the shopping when it is open food item, like fruits, vegetables, these kind of stuff. They pick up one apple, they will see whether the apple is right or wrong, and they will put it back, they will select another one. So that's where a lot of stuff which are open, right? So many people have touched it before you touch them. So when you bring them, you wash it, something like that.
But what about if somebody is just normally sneezing and not using the handkerchief or tissue?
No, that should not be happen. That is the public education we should do right now. Like no one should sneeze without a
Without the tissue.
handkerchief, or yeah, is absolutely must right now.
Yeah, even though they're not infected, but still when they sneeze, then it's still bad, right?
No, see, that's what we are saying. We don't know how many people are infected because
No,
there are
it's like a family
80%
member.
people. Yeah, there are 80% people, those who are infected, not showing any symptom.
Yeah,
So what we are hearing is only 20% of the people,
yeah.
because
Like what
many
if
people,
your
they
child,
recover.
if your child is sneezing and on the road and is not using the tissue?
No, have to. See, right now is a precaution. If you see like what Hong Kong government has done is like from yesterday, social distancing. And if you go to the Starbucks or the restaurant somewhere, they have like uh, asked very strictly to leave a table so that the distance is big enough. And that
Yeah.
is, the reason is very simple. They try to cut the contact. And one of the distance contact is sneezing. So if sneezing, we don't know, right? It can go very far. So it is
Yeah.
better not for ourselves, for other people also, to really, that's another way of wearing the mask, because when you sneeze, everything is stay to up to you. It doesn't go out.
No, but they sneeze, they remove the mask and sneeze so that the mask doesn't get back.
No, 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 cannot be. That's the bad habit. Yeah, that's not. That's one
Okay, I
of the
better
purpose
tell
of
that.
wearing the mask is like
Yeah,
if you sneeze, it sneeze inside. Yeah.
yeah.
So you mean we can sneeze into a mask? Because yeah, when I'm trying to sneeze, I remove my mask and I just make sure I have a handkerchief or something in my hand.
No, it's very simple. If you are infected, then you are infected. If you are not infected, you are not infected. So if you are not infected, and if you sneeze, it will stay with you. You remain as it is. You cannot create your own infection without infection. But if you are infected, and then you are doing that, you are spreading your germs to other people.
It's spreading to the other people. Yeah.
You can't
Okay.
Okay, I
infect
have
yourself if you're not infected.
yeah, I have a question. I'm seeing this very commonly amongst family members. So family members, couples, or there's children around. So where when they're within themselves, they seem to be sort of like hugging, or they don't mind coming and sitting close to each other. Uh, I mean, how sort of like can you keep telling them like don't sit close together or stay away from each other because they'll say, well, we're family, so it's okay.
That's what I'm saying. Right now, the people need to understand. In today's talk, one of the most important part was to understand the meaning of home quarantine. Home quarantine doesn't mean that you stay home. in fact, like inside a home, you have to follow all the precautions and the discipline what you are following outside, because at the end of the day, every person is an individual, right? So you are an
Yeah, but
individual
that's
person.
when somebody has to be quarantined. But what if it is just a normal life?
That's what I'm saying right now, because take the case of Korea. In Korea, when this thing happened, there's a lot of volunteering testing, right? So many people took the volunteer testing, and that's why they came to know there are so many people are infected, and there are a large number of people, those who are not infected. So we need to know who are infecting or who are not infecting, who are infected or who are not infected. So unfortunately, in Hong Kong, we don't have a test right now. So that's what I'm saying. We don't know who are infected. Therefore, the best way is to take a very good personal hygiene, isolation, quarantine. So quarantine is, the word is not about like home, there's a common word going on, home quarantine. So
Yeah.
home quarantine doesn't mean like you stay in a group and then hugging and laughing and doing everything. The happy time is going in the home. The same discipline should go for the each and every family member. It's more about the discipline at this moment.
So I think Mr. Manohar Chugh wants to ask a question, but he's not able to ask. Mr. Manoharji, are you online? He seems to be you have muted yourself, sir. Could you unmute yourself? Yep, so you can now ask a question. I don't know why he's not able to ask.
Yeah. I can hear you, Manohar.
Thank you very much. Briefly about your excellent presentation. Now coming to my question, you started your presentation by giving statistics of the number of total cases, and let's say 91,000 today, and death about 45,000, and the recovered cases only 110,000, which is about 12% of the total infected cases. You also said about the vaccination may not take may not be available quickly because of the first video test on animals, then on a human, and then the health authorities certificate. Normally, of course, I understand it takes a year and a half, but this time maybe 6 months. Now, until the vaccination is not available, they are using the cocktails of the drugs, which is a combination of drugs which are used for SARS or influenza or pneumonia or malaria. And by using these drugs, some of them are already being cured, but the number is quite low. And you are saying that these drugs, they work on some people and they don't work on other people. So
Yeah.
have you made any chart that these drugs work on which people? Like, I'm just giving example, not exactly. Suppose people, they say, oh, blood group A, blood group B,
Oh.
blood group O. So they have any kind of chart which says these drugs works on these kind of people and these drugs doesn't work on that kind of people?
Good question, Manohar. You can hear me?
Yes, I can
Yes.
hear you. Thank you.
Okay, good. So it's a very good question. A lot of research going on right now on this particular thing. So what we call like pattern identification. So right now it's too early. So say for example, China has its own experience, Korea has its own experience, Italy has its own experience. Every country has their own experience. And right now, the world community, scientific community are sharing data with each other. So the only thing so far came out that most of the people who are not able to survive or collapse or died, the people have a secondary health problem, right? Like they have a high blood pressure or heart disease, or diabetes or liver problem or the kidney problem. So there's a lot of multiple health combination was there who was not able to manage it. The people, so there's a one part of it. You remember, there are more than 60, 70, 80%, no one knows right now exactly till more research come out, that this virus is infecting them, but they are getting recovered even without having any symptom. So they don't know whether they have this virus or not. So these are the people, the asymptomatic people are the big hope to find the solution in the future of this virus, right? Because this virus infected them but couldn't make them sick. So their immune system was able to remove the virus or kill the virus. So there's a lot of research going on the immune system now. So the idea what you say that somewhere people work with a different drug therapy, it work well with the people if we generalize with the people which have a very good strong immune system. So right now the immune system is the key. If the people have a good immune system, they respond well. They respond very well. Okay, and they are responding in a different part of the world. So that remind me to add one more thing. At this stage, all of us must increase certain kind of food in our diet, which are the immune enhancing food. Because better if we keep our immune system high, low is the chance to get the infection. So this is like a ultimate a shield in our body, that beside the quarantine, isolation, social distancing, if in case virus enter in our body, and if the immune system is really, really good, it can really suppress the virus.
Yeah.
So what are the foods?
Saying about the immune system as strong and they don't have any chronic health problem. But my question is again the same thing, that do you have any chart which says, oh, this drug works on certain people who are a blood group A or blood group O or some other kind of a chart? So do you have any such
No,
chart?
I got it. Like right now, the data is transferring, and the people, the healthcare worker, the first, and they are too much busy on the front line. So there is a no certain information came out so far, but will come out so far, because that's what exactly you are talking will become the fundamental, the base of the finding the drugs which can work. Okay, so exactly what you say, that's the thing. We have to find out the blood group. We have to find out what kind of similarity. So we have to find out the pattern,
Yes,
that
correct.
this is the pattern of the health condition where, say, for example, the drug chloroquine is working,
Yes.
like that. So over the time period, there has to be a big data set which will come from all together, from Italy, from Spain, from US, from Korea, everywhere. So that also will take at least 5 to 6 months. So nothing is very quickly possible till 6 months.
Why transferring the data takes so long? Because normally now the everything is very fast because of technologies. So data should not take 5 to 6 months. That's too long.
No, it's basically the data, collecting data is already there. The collecting data is something, and pattern diagnosis is something else. Pattern diagnosis is something like kind of like a research kind of things they have to see, like because this type of things called observation science. So whatever the people have cured in certain situation, it was an emergency situation, so no very detailed health record was maintained. It was treated them for the SARS first, right? So yeah, the pattern diagnosis will take some time. It's a regular scientific process, but many people are working. The vaccination trial has started already. The first phase result of vaccination will come in the month of June. The data trial is started again. There are a lot of drug trials going on around the world. All the trials, like the first phase will come June, because every trial has to have at least, like everything has to have a 2 or 3 phases. So we are already close to phase 1. When the phase 1 will give the good kind of indication, the people will may move to phase 2. It's not like a miracle kind of things. It has a procedure.
So how long does everybody have to be under lockdown and being so far
No,
from each
okay.
other?
Now let's see about Hong Kong situation, right? So every day right now, 50 cases on an average. At the beginning of my talk, I said reproductive ratio, which is R naught. Right now, it is 3 around the world. Means one person is infecting 3%. So there's a possibility of like exponential growth. So when the R naught is less than 1, means one person infected but is no more able to infect the another person, that's where it go down, right? So that is the way when we isolate all the infected people. This is the key. Isolation of all the infected people, which Korea has done. They isolated all the infected people by having the volunteering test. In Hong Kong, we don't have such a large scale test, but government is talking about it. They very soon they will start testing people. So once we have a large scale test, we know the data, and then we can predict like, okay, how long the lockdown will go. But now it's not depend on Hong Kong. Now we are very much depend on the international traveling, that US, whether we should open the border. So many people infected in the US, Europe, if they start again coming into the Hong Kong, because second wave of infection in Hong Kong came from the imported cases. So we have to keep the border closed till the situation started recovering in Europe and America. So it's not all about Hong Kong.
So how do you increase your immune system? What kind of foods should we be having?
Okay, so this is very common. You go on internet, there are so many things, but one of the best stuff is garlic. Garlic has a very, like, I cannot explain here on the scientific pathway, but garlic has a very strong immune enhancing system. Vitamin C is obviously a very strong one. Papaya has a very strong one. There's a whole lot of list is there, and it's very easy to make sure. And then drinking a lot of like fluid, warm water. There's a lot of a way to and can increase the immune system. In fact, like what I have planned, like in a week time, I have organizing a special Zoom session only for the immunity, like talking about how the immunity works and how people can maintain the higher immunity, because that is going to help a lot to the people.
My friend would like to join. Is it possible to join like that? I would send an email to Veena and put her email.
Sure. See,
Okay.
like this is the thing, like it's a kind of like socially responsible citizens who
Yeah.
understand like their own responsibility, and they are helping the people around them. So what we are doing, why we are doing all this, is just to helping people to understand what is the right information, where to look the right information, what is the real threat, and what is the rumor. Because we have to be far away from the rumor, because rumor create a lot of stress. Rumor create a lot of panic. Rumor create a lot of anxiety. But once you have a fact in front of you, you are more calm and composed, and you know how to deal with it, right?
Right.
So the idea is like getting your information. What is your source of information? You have to get your information from the reliable source. So for example, Hong Kong government has put the website. So anything you want to know about Hong Kong, you don't look what is coming on the WhatsApp. You just go to the website, the government authorized website, and you check the website. You want to know about America, you go to the America, like National Institute of Health or CDC, those kind of website. The European Health, like those kind of website, World Health Organization. So there are official agencies. So just get your information from the official agencies. But I want to give one very good example which establish how the science is changing. In India, in US, it's a yesterday news in US. People say like those who are not infected or those who are like healthy people, they don't have to wear the mask. Now they are changing, like everyone has to wear the mask, you know. So the idea is like as we are learning, as the scientific community is learning, people are updating the information. So that's what we have to understand. There's nothing, we cannot say this is wrong or this is right. Right now, as the disease started, scientists are also learning with this disease, and we all are learning, and every time we are updating the information. So information can be contradicting. So if you see the information of the World Health Organization in the month of January, and now you see the same information now, you will say, wow, the World Health Organization is contradicting themselves. This is the wrong interpretation. No, World Health Organization gave the information in January as per the present status in January, and now they are giving the information in March or April as per the present status of March or April. So that's what we have to understand many things like that. So the credible source of information is absolutely important.
Thank you.
Okay,
Yep.
anyone
Okay.
else have any final question before we close the session? Chandra, I think you wanted to ask a question. Okay, she's not here anymore. All right, so I think we will wrap this up. We will be continuing, we will be having more sessions like these to educate the public educate and update the public on the facts and the current status of coronavirus on a regular basis. Plus, we will be sharing a lot of knowledge about immunity and other health related information as well via Zoom. So do keep in touch with us. We will keep in touch with all of you. And if you have friends, family, not only in Hong Kong, but all around the world, please, you can share this, share their contact information with us. We will invite them because we are online right now. We are maintaining social distance. We're not conducting our classes at Nevada. So it's available globally. Anyone can join globally. Do share this with all your friends. And let's keep in touch. Let's be safe. Let's be healthy. And let's just be socially responsible for other people's health, but more so our health as well. So thank you, Dr. Sanjay. Is there anything else you'd like to end with?
I think like I share most fundamental information, but there is some deep message here. So today's takeaway message is stay home, stay safe, understand the meaning of quarantine, take full precaution, absolute precautions, go one step further because we are dealing with something invisible we don't know. Thank you.
Thank you very much.
Thank you.